had 1,000 people Zooming together um, over the last 12 months, 11 months, 12 months. Um, you know, as a former member of the Obama administration, what are your thoughts on our national policy approach to COVID uh, over the last 11 to 12 months?
Dora, thanks for having me. And I do want to mention, it would be wrong if my mother would kill me if I didn't mention that I've got a single sister. She's looking, her bio data will be in the chat. It'll be available later. She's a doctor. She checks all those boxes. So putting it out there to the
No,
community.
this is great because I'm part host and part
Yeah.
matchmaking.
I mean, there's no reason that we can't generate a little bit of love on this
for
Zoom.
one.
So
It's
I
two
have
for
to say
one.
that. Yeah,
Yeah.
exactly.
Thank you for sharing that.
And if my mother's always very angry and like, Beta, why don't you get it? Why can't you find a husband for your sister? So I'm
That's why
doing
we're
that.
here,
Right.
actually.
So now on to more serious matters. There's nothing short of saying that this past year has been no COVID strategy. I mean, the strategy has been to willfully allow people to die. We've crossed 400,000 deaths because we have had no national policy. We've had a president who was basically committing genocide on a daily basis by ignoring that we had a real virus and ignoring that, or blaming it on China, blaming it on others. And shockingly, South Asians have suffered greatly from a number of these debacles because we don't have data on South Asians. And when we do, we know that about 37% of South Asians in New York City were positive for coronavirus when they were tested. So we have an incredible set of problems to climb. But as you heard Neil say, like on day one, that was something that President Biden and Vice President Harris actually put forward. They put forward a national plan. So now the hard work is really up to all of us because we have a plan, we have federal support, we need to mobilize Congress to get funding, and then we actually have to do the grassroots work to kind of dispel the misinformation that the president spewed in his Twitter feed and his family spewed in social media. And then we finally have to do something to reinvigorate an entire generation of people who are fatigued, they're stressed, we have PTSD like I've never seen it. And we've neglected our children because we've isolated them, we've taken women out of the workforce, and we've done everything possible to strip away any part of the American dream. So we're going to have work to do, not just this year, but it's going to be, I think, on our shoulders. And I can't think of a better community than this one who brought President Biden into office. And I'm just I look forward, and I slept well for the first time this week, and I'm looking forward to getting more sleep.
Same. I feel like we're all kind of experiencing that, and sleep is such a great healer for all of us. I have to tell you that watching Dr. Fauci on the renewed White House press conferences, that guy looks like a new man too. Like he looks like he's been uh, vacationing in Bali, and I think so much of it is just the joy of being able to speak the truth and be honest and express medicine as science versus fiction. So that feels really representative. And thanks so much, Dr. Patel. And let me turn it over to you, Dr. Bhatt. You've been a chief health officer. At all the levels, city, state, national. You've done all the things. So what are those next steps that you hope to see from the Biden-Harris administration as we move forward and as we try to address this pandemic?
Thank you so much, Faiza. It's an honor to be part of this panel and this incredible moment with all of you celebrating history, better days ahead for our nation and the community with President Biden, Vice President Harris at the helm. And, just the other day, the sun actually rose, and it was brighter. And, I think about it this way: as physicians, we're trained to treat our patients. And I think now it's really time with this administration, we think about how we treat our neighborhoods as if they were our patients. That means combating the systemic racism that keeps people of color poorer and sicker than others. That means investing in communities and jobs. It means providing equal access to care for all Americans, regardless of their skin color or medium income and their zip code. It means taking care of our veterans and helping each other and restore trust. And so, as Kavita said, we actually have a plan, and for the first time in this pandemic, and we applaud that science-driven approach that was put forward that takes important steps to expand access to supplies, distribute vaccines, address inequities, and give public health officials additional tools they need. That being said, the administration needs to fact find quickly because of the lack of transparency and collaboration that they had on transition. That's going to be really important. Continue to lead with science and public health interventions we know work. We've got to work to accelerate vaccination distribution, fight misinformation, and address the vaccine hesitancy by leading with empathy, compassion, and science, including engaging our faith leaders and influencers like that of this community to be credible messengers and allay fears. I think we got to continue to scale testing and particularly rapid testing to make it accessible and available and use it appropriately for surveillance. Our public health infrastructure has been decimated at the state and local levels, so we've got to invest in that. And then continue to support our caregivers for who this virus has taken an incredible toll. And that includes thinking about mental health and supporting the mental health needs that families, our community, our caregivers will have, as well as veterans and those with disabilities. And I think there's been important policy actions that have supported care in the ways that we needed it during this time. And that includes telehealth, digital health, and building broadband infrastructure for rural communities and those without access, I think is going to be important moving forward. And two other really important things, I think economic recovery, which we heard about earlier, and have to support essential workers, small businesses that have been impacted, including those that our community leads and builds and runs. And then equitable recovery. We know that we haven't sufficiently invested in public goods and infrastructure after past disasters. We can't make that mistake here. We need significant and equitable investments so that we ensure resources flow to the Black and Brown communities that have been most damaged by historic divestment from the current crisis. And I was really struck by the moment at the reflecting pool where President Biden and Vice President Harris honored those who we've lost to COVID and drew inspiration from them. And I think that honoring of their loss and then coming in next day and taking action really gives me a lot of encouragement and hope. And I think we're on a good path, but I think it's going to take all of us to continue to push on these critical issues to make a difference moving forward.
Well, I'm so glad you talked about hope, because listening to you for a second, I was like, oh boy, we got a lot of work. This is a really long list. And there's so much, just dealing with a crisis and then also repairing the damage that was done from the last 4 years. So it's just like, on top of and top of and top of. And I actually just want to say, I love, you're talking about we need a plan and science driven, like the baseline for things. And hearing you talk about our mental health needs, I think that is something that is so forgotten about, or actually not talked about in South Asian space and South Asian community, and not really emphasized how important our mental health is. And like you said, Dr. Patel, like we are suffering from PTSD. Just the fact that we're like, we have a plan. This is so exciting. Like the baseline is exciting to us. We've been struggling. So thank you so much. And, I want to turn to you, Dr. Purvi Parekh, and hearing Dr. Bhatt talk about, the vaccine and that rollout. I mean, that's something that's a huge issue. And, I personally, I live in LA, but I'm in Toronto right now and thinking about Los Angeles. They're like, we don't know if we're going to get the vaccine until 2022. So could you, Dr. Park, talk a little bit? I mean, you're a nationally recognized immunologist. What advice would you give to people out there in terms of how to manage the seriousness of this record, of the record-breaking numbers, of the COVID numbers, with the hope of the vaccine rollout?
Right. And as an immunologist since day one of this pandemic, I've been asked immune boosters. I've been forwarded WhatsApp messages from groups of aunties and uncles abroad. I've seen it all, but the single most effective immune booster is a vaccine. It's controversial, it's politicized, but it shouldn't be. This is the only thing in healthcare where you get a shot and 2 weeks later, it's like magic, you have immunity. You get the second shot, and another 2 weeks later, you have immunity. So the most important thing all of us can do for ourselves, for others, is get vaccinated as soon as it's offered to you. You know, I was actually involved in the development of the vaccine from day one in the clinical trials at NYU. So I can assure you it's safe. My parents have gotten vaccinated. I've gotten vaccinated. So I would not, send people I love towards something unless I didn't believe in it. And the rollout is a challenge. You know, we're going far too slow. Dr. Fauci is estimating we need at least 75 to 85% vaccinated to even get to that herd immunity. And we're currently losing more people on a daily basis than 9/11 and then Pearl Harbor. It's just staggering. And speaking of PTSD, I think we've just become used to it. We've become used to death and destruction, and we shouldn't be used to it. You know, the amount of people that we're losing is just unfathomable. So until, that vaccine rollout is corrected, until hopefully the Defense Act is activated so that we can produce more vaccine, more candidates get approved by the FDA, we still have to be very careful. We have to protect ourselves, we have to protect each other. That mask wearing can't stop even after, let's say you're lucky enough to get a vaccine, the hand washing, the distancing, because right now we're so close, but we're also at a tipping point, So this is, I believe, the beginning of the end, speaking of hope, but we can't screw it up. There's new strains out there, but now we do have a glimmer of hope. So, just hang in there. But if you want an immune booster, don't look at your WhatsApp messages, get the vaccine. I mean, I'll text you on WhatsApp if you want to go get the vaccine.
I feel like the don't look at your group WhatsApp messages from your aunties and your khandan and your relative, like that feels like good advice across the board. Like just don't, like they're going to send you pictures of birds. And then there's some like verses from any name or religion. There's verses in a book. There's all the things you can do. There's definitely some fake news in there. It's fine. It's just your mom sending it to you. Yeah, I mean, thank you so much for that. And I think like really demystifying and just reminding people that the vaccine is safe. And I know something that I was told that I really kind of move with is assume that everybody has it, you have it, and everybody has it. So move in space that way to protect yourself and others in the most cautious way. Well, and I know we are here to celebrate tonight, and we do want to have hope, and we do have hope, and we have to have hope to move forward and to be excited about our potential. And there is so much more for us to do, and with this new administration. So I want to turn it to you, Dr. Lipi Roy. You're an internal medicine doc and the medical director for COVID isolation and quarantine sites for Housing Works in New York City. I mean, wow, I feel like New York just really, really went through it in the beginning stages and the beginning months of this pandemic. And, I mean, it still makes me emotional thinking about those images of Italy and New York. Like, that's what I felt like was just hurting watching folks, and we just didn't know what to do, and we couldn't do anything from afar. I mean, could you talk a little bit about what your hopes are for the coming year in terms of when and how we can reclaim some sense of normalcy, whatever that means, or some new place of being in this country?
Yeah, well, first let me start with an apology to my friend Kavita. I don't have any bio-DACA for her sister, but I am optimistic that every Indian mother and auntie watching is already logged on to shadi.com and Bharat Matrimony. Fazia, thank you so much for moderating, and I thank you to the organizers at South Asians for Biden for pulling together this phenomenal event. I've dedicated my career to serving the underserved as a former primary care doctor to homeless patients at Massachusetts General Hospital and teaching Harvard medical students about drug addiction and mental illness among society's most marginalized, and then working in the nation's second largest jail complex, Rikers Island here in New York City, where I am. I learned that health isn't just about prescribing medicines. It's about where are you sleeping tonight? How are you getting your next meal? Who's your support system? in order to regain any sense of normalcy, in my opinion, I think we need to do three things. We need to massively increase funding for public health at the federal, state, and local levels. Remember, disease kills far more people than war, and yet the military gets far more funding than CDC or NIH. The second thing I think we need to do is dismantle racial injustice in every sector: medicine, government, education, criminal justice. And then third, and most certainly not least, we need to educate, empower, and compensate girls and women. Remember, in the US, pandemic-related unemployment was devastating for women. And then globally, remember, during a crisis, it's girls who are yanked out of school and into hard labor and early marriage. And yet data clearly shows that gender equity benefits the entire community. So I am confident that the Biden-Harris administration is fully committed to using empathy and an evidence-based approach to tackling these critical health issues. So thank you and be safe.
I mean, thank you so much. And wow, that's also that we can just do that. Like, let's just, those three things sound really easy. I feel great about it. I also feel excited about the fact that we are going to empower women by getting Kavitha's sister married. But she's a doctor, so it's fine. She's old enough. But in all seriousness, thank you so much, not just for your wisdom and all the work that you do, but for sharing this knowledge and creating these conversations. I think, sometimes it's like, aunties going on WebMD and being like, no, I know the solution. Just dip your toe in turmeric. It's good. So we need you, and you are doing the work that matters. Thank you so much. We're done with the healthcare panel. And now I'm going to turn it over to Shivanti, who is with South Asians for Biden. And also, thanks so much for having me, y'all. This has been really fun and lovely.
Thank you, Fawzia, and thank you for that wonderful panel. Well, we would be remiss if we didn't take a moment at the end of this spectacular evening to thank the people who really made this movement. South Asians for Biden has shown us what can be done when we put our hearts and our minds and our energy together, and we want to thank all of the incredible people who have put together this tremendous effort to bring to fruition 80,000 total calls to voters, 45,000 text messages, over 40,000 total postcards sent to Georgia voters, and so much more. We are a movement of dozens and dozens of state directors across the country and hundreds of volunteers across the nation who have really created change across our country. Tonight is for you, for all of you. Let's celebrate this victory and let's really enjoy this moment, because tomorrow we all get to work. And I'd love to introduce Praveen.
Thank you, Shivanti. On behalf of South Asians for Biden, thank you to Mr. Katyal, Mr. Penn, Ms. Sujani, Mr. Raghavan, our congressional representatives, and all of our talented speakers, thought leaders, faith leaders, artists, and performers. And thank you to all of you watching across the nation. And now it's your turn. Please get on your feet and join us as we welcome DJ Rekha. DJ Rekha is based in Jackson Heights, and they have performed internationally and DJ'd in the Obama White House. They produced the South Asian Block Party for Biden-Harris, Basement Bhangra, and is on the board of Chaya CDC. You can follow them on IG at DJ Rekha. Please make some noise and join us in welcoming DJ Rekha.
What's up, everybody? How you doing out there?
South Asian Block Party for Biden-Harris, Basement Bhangra, and is on the board